Welcome to Epg Pathshala. My name is Purendra Prasad. I work in the Department of Sociology, University of Hyderabad. Today we are going to talk about privatization of health services in India. This is 10th module in the Sociology of Health course. What is privatization of health services? And particularly in terms of health services, it actually implies a lot of things. Now, if you go back before independence, even during the colonial period, there was actually private health services that were provided to the people. Okay, and even if you look at pre-colonial period, a lot of these Ayurveda or the other kind of Veds and Kavirajas and Hakims were actually providing the private services. It's not that there was a government healthcare system through which the native practitioners actually provided the service. In post-independent period, immediately after independence, Indian state established government healthcare system at every level, from village level to that of mandal to that of district and state level healthcare services. So, despite that, there is actually growth of private services in the early part of the independence period, post-independent period. But there is significant difference between the privatization of health services that we are talking about from late 1970s and early 80s onwards, and that of privatization prior to that. The privatization from late 70s and early 80s is more to do with the commercialization of the healthcare services. So, this is where I think the moment we talk about market actually playing a very important role in redesigning the healthcare services and programs and intervening on the human bodies, then one needs to actually look at how this has actually impacted on Indian society. Privatization of health services, which was something is common phenomena across the globe, is much more a kind of a deeper question in the third world context. This is primarily because a large section of the people living in rural areas dependent on agriculture, the income sources are limited, and therefore the expectation of the state in third world context is much higher compared to the developed world. And this is one distinction that we need to understand why privatization of health services actually needs to be discussed at length. When you look at the kind of government healthcare system that was designed in the early part of the post-independent period, that is 50s and 60s, there was a huge public investment that was made in terms of hospitals, in terms of medical education, in terms of medical research, training the personnel. A huge public investment both in terms of infrastructure, manpower, education was actually spent. And a lot of these medically trained doctors who started actually practicing in small towns and in urban locations actually was the basis through which privatization of health services started. If one looks at the 1946, that is just before independence, Bohr Committee, Sir John Bohr Committee, which actually provided the basis for healthcare design in India. Sir John Bohr Committee actually talked about two things. One, health should not be treated as a commodity and it's not for sale. Second, it recommended saying that health should be made available to every citizen at their doorstep. This is what Sir John Boer Committee actually recommended, and based on which, when the government healthcare services actually were implemented, there was also a strong kind of a policy decision that was taken, saying that government doctors cannot, or they are not permitted to practice privately. That's because the medical profession as a noble profession, where the doctors actually are supposed to provide services for the large majority of the sick poor in this society. Only during the late 60s, when Mudaliar Committee and then other healthcare committees were constituted, then they tried to dilute this particular clause, and from then on private practice actually became little more rampant, and then there was diversion of the patient pool from the public healthcare to that of the private kind of nursing homes, etc. But what began as, you know, diversifying the healthcare services and providing actually healthcare services at a reasonable kind of a cost to the patients, in the late 70s, actually it took a paradigm shift in terms of establishing the nursing homes and medium kind of hospitals across the country, and most of these actually were established by the doctors themselves, and that actually formed the basis for privatization of healthcare. And the private healthcare grew significantly in a decade because of the manpower that was actually available, trained in the government medical colleges. Government medical colleges actually have been very, very credible, reputed, and these trained medical personnel actually joined the private nursing homes and medium kind of hospitals because it provided higher reward structure. With the liberalization policies, with the kind of shift in the state's approach towards earning more revenues, and actually were trying to cut down the state kind of a commitment towards the healthcare, then the growth of private sector actually took a new turn. There was concession in terms of import duties on the medical equipment that was actually brought in here. Indian state invited a lot of these NRI doctors to India to establish their own kind of corporate hospitals and tertiary hospitals in different cities, and that actually was encouraged by the government, saying that it would provide land at a marginal price, and it would provide a lot of incentives and subsidies for establishing the medical kind of hospitals. It started with Pratap C. Reddy from Chennai, who actually established the medical hospital first, and with huge lobbying from Indira Gandhi and Pranab Mukherjee, who were actually key actors in the government at that point of time, who provided Philip to establishment of this corporate kind of a hospital right in the beginning, and recognition of private hospital as an industry actually was another turning point in terms of private healthcare becoming a kind of a large kind of a industrial kind of a setup that came in. So we are talking about privatization of health services in the Indian context primarily because, one, there is growth of private sector from, as I said, late 70s onwards. Second, I think the corporate sector actually was able to establish their monopoly and were able to actually established chain of hospitals in all the major cities and urban centers in 90s. They also actually started medical colleges and other kind of institutional kind of mechanisms. And what is important is that with the increase of these hospital services, the regulatory mechanism actually was weak. It was weak and it is weak even today. So the accountability of the private healthcare sector is actually inadequate or nil in the Indian kind of a setting. This is one of the major kind of a concern that scholars like Ramabaru, Antya, and Sunil Nandraj, a lot of scholars actually wrote extensively indicating how private sector grew with the basic kind of a investment and without actually having to spend on medical education or in terms of research, etc. So that's one dimension. And with the lack of regulation, there was also lack of ethical kind of issues. Okay? A lot of unethical practices became rampant with the rise in privatization of health services. What is required in terms of conducting a surgery, whether a particular kind of a hospitalization is required or not, there was no control, there was no ethical principles involved in terms of these services. So this was the second dimension I think one needs to look at. But third important thing is affordability. While there is a growing inequality in terms of different classes of people, the healthcare cost actually increased enormously. And with the privatization of health services, the basic kind of services became very, very distant for large masses. So this is one of the important dimensions that one needs to understand, that accessibility to the healthcare services actually became an important dimension with the decline of the public healthcare system at different levels because of the withdrawal of the state in terms of providing the public investments in health sector, in terms of managing the public health centers. So while credibility of government healthcare actually came down, and the enormous growth of private sector actually created a situation where the sick poor actually faced enormous problems in this country. Sociologically speaking, here we need to understand how certain kind of institutions, certain kinds of services actually grow, and how market actually plays a very important role in controlling the lives of the people and in terms of the health status of the a particular nation. So here we are talking about privatization of healthcare primarily because we are saying that health is not a commodity. Health is not for sale, where health is supposed to be a public good. And unless the people of a particular nation actually are healthy, there is no productivity, there is no efficiency, there is no progress. So there is a deeper kind of a relation between the healthy kind of a population and a kind of a progress of a particular nation. Amartya Sen and others actually talked and extensively have written in terms of understanding these dynamics, how health status and educational status actually plays a very important role in fostering the advancement or progress of a particular nation. So in that sense, we are talking about the privatization of health services in the Indian context. When you look at the way private health sector actually has increased the kind of services and their cost, um, and also the way pharmaceutical industry, which also played a very important role in terms of supplying the non generic or branded drugs, and these branded drugs were actually advised by the private healthcare services, that actually increased the cost of the healthcare enormously. Okay, so when you look at say for instance, the healthcare expenditure of the poor, okay, India actually ranks in the top few countries where out of pocket expenditure is enormously high. Okay. Today, a lot of people actually have to spend from their own pocket rather than rely on the government healthcare or reasonable kind of a healthcare system. And this situation in terms of not able to afford has actually also led a lot of people not to actually access any treatment. In fact, studies done in 7 states by Chatterjee and others indicated that in Bihar, in Uttar Pradesh, in Madhya Pradesh, Rajasthan, in Jharkhand, and other in Orissa, uh, a lot of money. It's about 40 to 55 percentage of the people do not actually access any healthcare services, whether it is modern or non-modern, because it is actually very expensive. While public healthcare system actually does not function and has serious limitation in terms of providing healthcare services for the needy population, private healthcare actually has become very expensive and unaffordable. This is a dilemma in which I think the entire discussion actually is taking place in terms of NHS, national health kind of services that are provided in UK, or if you look at Canadian kind of a healthcare system, which is actually a very judicious mix of both public and private healthcare, which is very efficiently delivering the healthcare services. While the Western countries, which are actually trying to advocate in the advanced capitalist countries, where market actually is playing a very significant role in terms of capitalist accumulation processes, those countries actually retained healthcare very effectively in terms of providing it to a larger proportion of people in their own countries. So UK is one good example where healthcare is available through NHS. Canadian example is another one. And then if you look at either a Cuban kind of a system of medicine, Chinese system of medicine, one could actually see that there is a judicious mix of the local Chinese medicine and that of the allopathic medicine, which is still kept at the reach of the poor people. So the efficient utilization of knowledge resources actually is something that is wanted in any country, but in the Indian context, what happened is that the healthcare cost actually has created much more inequalities in terms of people. There are a lot of commissions. For instance, Jayati Ghosh Commission, which was actually constituted in Andhra Pradesh to study the farmer suicides, indicated that one of the major factors where people are actually indebted and have been committing suicide is because of the high cost of health and education. So that actually is another dimension to look at. So the way I think we are trying to look from sociological point of view is that these the public system, private healthcare system, and in terms of other systems of medicine, are all actually linked in a sense that how the state actually promotes its own class interests. And therefore, if you need to understand the class basis of the healthcare provisioning that has occurred in Indian context, it becomes very important for us to understand the historical trajectory of the growth of private sector, both in terms of small, medium, and the larger or the corporate hospitals. Let me sum up. Private healthcare actually existed even during the pre-colonial, during the colonial and post-independent period. The significant difference between the earlier form of privatization and the privatization in the last 3 decades is that the commercialization of the healthcare services, which is what makes a distinction in terms of understanding the growth of private sector in India. The privatization actually has created more inequalities and social distance. The way the poor actually have been marginalized are actually committing actually suicides and creating a huge burden because of the rising healthcare cost. And therefore it's important that we need to understand how inequality actually gets perpetuated. Thank you.